Follicular cysts in dogs. These are the most common cysts our dogs can get. This is what they are, this is what's causing them, and most importantly, this is exactly what you can do at home.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
So exactly what is a follicular cyst? Well, it's all about the hair follicle. The hair follicle, that's a tube-like structure. It exists within the top two layers of the skin, and that's where the hair originates from. All of our dogs with hair, just like us, we have millions of hair follicles. But if these hair follicles, they become injured, blocked, damaged, maybe affected by UV light, regardless, then they can be obstructed. Fluid can accumulate within that follicle. You might see a swelling, various areas throughout your dog's skin. They may open up and rupture, become secondarily infected. These cysts, they typically look like round, hard masses just underneath the skin. Often they're just containing fluid, but they may contain a thicker, almost cheesy-like substance. If your dog has them, they can be itchy, painful, and if they burst and rupture, it's very common to become secondarily infected because you've just got this open area of the skin. You have all this bacteria on the surface of the skin, gets into that cyst. Now you're dealing with a secondary skin infection. Certain dog breeds seem to have genetic predispositions, such as the Shih Tzus, the Yorkshire Terriers, the miniature Schnauzers, but really you can see this in any breed. Yes, your veterinarian can do additional diagnostics, but in general, if your dog has a cyst, it's probably a follicular cyst. In some of the small breeds I used to see in practice, they would have multiple cysts, they would rupture, secondarily infected, really uncomfortable. And it's hard because you could potentially do surgery on one, 3 or 4 more would pop up. So surgery really isn't the answer. Typically I would find as dogs got older, their immune system is less effective. So I'd often see more cysts then. And or they could have underlying disease. They might have hyperadrenocorticism, that's Cushing's disease, making them much more prone to developing these cysts. Other underlying medical conditions that predispose them to this, I would look for thyroid disease, so being hypothyroid, ruling out diabetes. There are 5 steps to treating these at home. Number 1, we want to clip and clean them. If you have some clippers, great. If not, just having some blunt scissors is fine. And what you're doing is you're just going to remove all that hair around the cyst. Then you're going to use some type of antiseptic. Well, you could use something conventionally such as this. This is hexadine. Chlorhexidine is the most common antiseptic scrub used in veterinary practice. Or you can make this effective antibacterial antiseptic scrub at home. We're starting with black tea, 1 cup. Apple cider vinegar, 2 tablespoons. And then if you have it, you can use this all-natural Castile soap. If you don't have it, that's okay. The black tea and apple cider vinegar, they're great antiseptics. But if you have the Castile soap, even better, because it can help remove all that excess debris. 2 tablespoons. Mix the tea, apple cider vinegar, soap concoction well, and just use that as a topical scrub. You know, if Tula had a little cyst here, after I'd clipped and clean it, I'd be scrubbing this really well, minimum twice a day. There, Tula. Number 2, the hot compress. And this is especially important if the cyst is not ruptured. The important thing about the compress is we're using the principle of primarily heat along with some potential topical anti-inflammatory to help open up that duct so the blocked follicular duct can open up and some of that fluid can drain properly. The simplest thing, you can just get yourself a cup of hot water. I prefer this. Topical green tea. I've got 1 cup here. I pour it in the hot water. It's still pretty hot. I can put my finger in it, but it's still quite warm. And that's what you want for a compress. You want not boiling water, but you do want hot water. Soak your gauze or your cloth in that nice hot water. And then you're going to put it over top of that cyst. And you're going to hold that, like it's going to be hot enough that you can touch the skin, but obviously not burn it, but nice and hot. You're going to hold that for 5 or 10 minutes while it cools down. Ideally, you're going to be doing this 4 times a day. Also compress topically if the cyst is open up and ruptured. Regardless, just using the principle of a compress, we're trying to get to the underlying cause where the duct itself is blocked. We're trying to break down some of that cheesy material, open up the gland so the fluid can drain properly. Step 3, that's treating the infection. Many of these cysts, they become opened up, secondarily infected. This is a great option to be giving to your dog orally, propolis. I find it's probably the best as far as I'm considered natural antibacterial. Very safe for our dogs and our cats. Standard dog dose, about 100 milligrams per 10 pounds of body weight daily. And this is something you can give for 14 to 21 days, sometimes even longer. It can be really difficult to clear up these cysts. Propolis, it's also got some good anti-inflammatory properties. And often in veterinary practice, it was a combination of an anti-inflammatory like prednisone along with an antibiotic. This has it both. It's got antibacterial properties, it'll deal with the infection, also it's anti-inflammatory. I want to show you another new topical antibacterial which has been really effective for infected cysts. The primary antibacterial properties, they're coming from tea tree essential oil. It is probably the most documented natural topical antibacterial. I've seen tea tree work really well for cysts. But then to make this safe, we need to dilute it with a carrier oil. I quite like sweet almond oil. It's a great topical skin oil. It's got some reasonable good antibacterial properties. Good in combination with tea tree. 1 tablespoon of the sweet almond oil. And we're putting in 20 drops of this is the tea tree oil. That makes about a 1% dilution, which is considered safe for our dogs topically. Then just mix it up well. Draw a small amount up into a syringe. And you're just going to put 3 or 4 drops onto that affected cyst, right? So you're just drizzling or dropping all over the tea tree, the almond oil. Do that minimum twice a day. Step 4, you're decreasing inflammation. One good natural anti-inflammatory that has been well used in dogs, CBD or cannabidiol. It's a whole lot safer than prednisone, for instance. I find it a better option than some of the anti-inflammatories. Typical dog dose, 3 milligrams per 10 pounds of body weight. I'd be doing that twice daily, especially when you've got these open inflamed cysts. Do that for 7 to 10 days, drop that down to then once a day. Another oral anti-inflammatory that also can potentially really help our dogs if they have sebaceous cysts is this, the sleep hormone melatonin. There aren't any specific studies suggesting using it for cysts, but it is a very potent antioxidant, so it can help deal with some of the free radical damage that may be causing the cyst to be blocked in the first place. Secondarily, melatonin is really important for normal hair growth. So we know, and that's what these follicular cysts are doing. They're the ones where the hair growth starts. So we may help normalize hair growth. It may actually help unplug that cyst. I mean, there's a bunch of good reasons why I would consider using melatonin, or I would definitely use it if my dog had a follicular cyst. Typical dog dose, about 2 milligrams per 20 pounds of body weight. Give that about 1 hour before bedtime. And if you've got a dog with a serious problem, because I would see some of the dogs in practice, they had 10, 20 of these cysts. Start out with twice a day of the melatonin. Do that for 14 days, then drop it to once a day. And the last topical anti-inflammatory I want to mention is this guy here, Preparation H. It's a reasonably good topical anti-inflammatory. Been well used in our dogs. I've used it on a whole array of different dogs that have underlying skin disease. Many of them respond well. I find it especially well if there is this localized inflammation. And for whatever reason, some dogs respond to the topical Preparation H. So you've got a dog that has these sebaceous cysts, especially the ones that would open up and rupture. Maybe you've tried some of the other suggestions, nothing else has worked. Consider trying the Preparation H. Just do that twice a day, do it for 7 to 10 days, and see if it's helping or not. Step number 5, we're getting to the underlying cause. We're focusing on the skin itself. We're going to improve the skin barrier, potentially deal with any underlying allergies. Because what we know is this skin inflammation, where there can be a breakdown in the skin barrier, that can directly impact these follicular glands. That's how they become obstructed. That's the underlying problem in the first place. For all these dogs, I always suggested a good quality essential fatty acid supplement. It's a great skin supplement, a good anti-inflammatory, may even help open up that duct. Typical dose of our krill oil supplement, it is 500 milligrams per 50 pounds of body weight. You want to do that twice daily initially when there's a big flare-up, drop that to once a day. But that being said, some animals need to be on this long term, and if on a slightly higher dose, that is completely fine. And it's just so much better if you manage these cyst flare-ups naturally. The awesome natural antihistamine anti-itch skin supplement, bioactive quercetin. This flavonoid found in apple peel, it also is a pretty potent anti-inflammatory, seems to also have some good antibacterial properties. So for lots of different reasons, I encourage you to try quercetin, especially a dog with these recurring follicular cysts. Typical quercetin dose, about 50 milligrams per 15 pounds of body weight daily. Then lastly, think about doing things to improve the skin barrier. Like that's the barrier here, your skin itself, the first skin layer, stops allergens from getting in, prevents this inflammatory response that could break down these hair follicles. Sunflower oil, it's a great natural ceramide that can improve your dog's skin barrier. An easy way to try it is to put it on topically, similar to how you apply, these monthly flea control products like Advantage perhaps. So you could just pour a little bit into a spoon or onto a syringe. Syringe is probably easier. Right little Tula. And then, drip it on in 4 or 5 spots along your dog's midline. He or she is going to absorb some of that. It's going to spread in through the skin. That'll naturally help strengthen their skin barrier. Go ahead, do that once a day. Do that for 2 or 3 weeks and see if it makes a difference. It's not going to do any harm. It may do a whole lot of benefit, and it's really inexpensive. I mean, you can use safflower oil, you can use sunflower oil. Do that topically. And if they lick some of it, it's completely fine because it's all natural. Oh, yummy. Oh, good for you, little poodle. Ensure that your veterinarian is looking for some of the underlying causes. One of the ones I did see in practice more commonly was Cushing's disease. These middle-aged to older, smaller breed dogs, their adrenal gland is producing too much cortisol, suppressing their immune system, resulting in these cysts. But interestingly, one of the newer alternative treatments for Cushing's disease is this guy here, melatonin. It's one of the remedies we discussed. So if you've got a dog with these cysts, look at these different steps I suggested. Consider some of the alternative remedies. Maybe you want to really think about this guy too. Thanks so much for watching this edition of Veterinary Secrets of Follicular Cysts in Dogs. Click up there to subscribe, hit the bell to sign up for notifications, then when you click that link directly in the box below, I can send you a copy of my free book.